Welcome to From the Editor, a weekly conversation with Columbus Dispatch reporters who author our Sunday cover stories in the print newspaper and on dispatch.com. I'm Mike Shearer, executive editor of the Dispatch and dispatch.com, and I'm here today with reporter Samantha Hendrickson to discuss this week's cover story on rural healthcare across Ohio. Welcome, Samantha.
Thank you for having me. Always a pleasure.
Okay, great. So first, I wanted to take a step back before we get into your story, talk about your role here at the Dispatch. You joined us last year, and the beat was kind of a new one for us. It's called the Business of Healthcare. So tell us about what that entails and what you're doing to inform our readers about healthcare issues here in Ohio and Columbus.
Yeah, so it's a new beat, but it is very clearly needed. You know, Central Ohio is such a hub of different health systems that are only really growing by the day, whether that be Ohio Health, that's now in all 50 counties, or 50 of the 88 counties across Ohio, or OSU, that's constantly growing and shaping a lot of research, or Nationwide Children. I mean, the list goes on and on. That really healthcare touches every part of the economy in Central Ohio and beyond, but there's also innovation and research, workforce, that's all happening. So this beat was very much needed, and I've had a fun and challenging time telling all of the very many stories that have to be told and should be told about this particular industry here.
So in Columbus, we obviously, the obvious manifestation of this is the building, the new Ohio State Wexner Tower off 315 there, the Ohio Health's building at Riverside and Grant, and probably other places that I'm not aware of. Children's is about to build a second tower to mirror their other tower. And Mount Carmel's busy doing things too up on Sawmill Road and other places. So that is a big part of what you see here, but there's a lot of complexities that go with that, obviously. In other parts of Ohio, the story is a lot different, and that's what your story for Sunday focuses on. What access options do people have for rural health care outside of the Columbus metro area, or people who come here for care? So tell us about how the story came about, and kind of what you found in your reporting.
Yeah, so this story, a story I'm very passionate about. Wasn't aware of a lot of the ins and outs and the issues that I wrote about until I wrote about them and talked to people actively experiencing them. But now have really developed a passion for writing about this. Just in the reporting that I've done for the story, I could probably write more stories for a year just simply on rural health care. I was invited out to the opening of the groundbreaking of a hospital down in Belpre in southeastern Ohio. And at first I was like, why, I mostly cover Central Ohio, but the people who invited me were very adamant down at Memorial Health System. And said, please come, please check it out. And so I did. I made the 2-hour drive down to Belpre. And Belpre is a dot on a map. It's very tiny, but it is now the site of what will be the first women and children's hospital in southeastern Ohio. Yeah. And prior to that being built, I mean, as it stands now, a lot of women and children have to drive 50 to 100 miles, around 2 hours, just to get specialized care. So it's a very, very big deal, right? And as I was talking to industry experts there, Scott Cantley over at Memorial Health, very, very passionate about rural health care, very helpful on this project, said, this is just the tip of the iceberg. Rural health care is in a lot of trouble. And this is hopefully helping, but there's a whole bigger picture here. And so that's what I was able to try to dive into, is this bigger picture. And this is even, there's a lot in this article, but this is even just a 30,000, 50,000 foot view of what the rural healthcare issues and infrastructure are in Ohio.
So for your reporting, you and Sheridan Hendricks, who's one of our reporters, also does some photography work for us. You guys drove down to Morgan County for a day. Morgan County, for those who don't know, is about 80 miles southeast of Columbus, south of Zanesville. Not a great direct route to get there, obviously. So tell us a little bit about Morgan County and why you went there and what you found when you were there.
Yeah, absolutely. So we were very generously invited by John W. Finley. He is the mayor and the fire chief of the county seat, McConnellsville, in Morgan County, which is about 14,000 people, a little over 14,000 people roughly in population. So he oversees not just as the mayor, but also oversees the fire department, as well as the emergency services. And he said, we want you to come out here because we want to show you, what it's like to live and operate and be in a local official and leadership, like in a county that has no hospitals. So Morgan County has no hospitals. And according to the Ohio State Medical Board data collected from there, there is one doctor that had their public business address listed as there, as Morgan County. But when we spoke to John Finley and some of his staff, they said, no, that doctor has now retired. So there are no hospitals in Morgan County, and there are no doctors in Morgan County. And so what happens with these emergency workers who are very dedicated, who have grown up there, who have lived there for a long time and around the area, a lot of the services that you see at your primary care doctor for, that you go to a hospital for, it falls back on them. So they're often doing things that they wouldn't necessarily expect to be doing, running around, at all hours of the day, taking care of people who don't have any other access to any kind of emergency care, because the nearest hospital from McConnellsville is about a 30-mile drive to Zanesville. And if you're any further east than McConnellsville, that's going to get a lot longer of a drive. There are very few, I believe he said 4-lane highways. I think there's only like 2-lane roads in Morgan County, which is something that in Columbus I don't think is super fathomable to a lot of people. But he was very generous and took me and Sheridan around McConnellsville, up and around all of these hills in McConnellsville, these unpaved roads that had no guardrails, very hilly, and it was pretty astounding to think about getting an emergency vehicle, let alone like a fire truck, up and down these roads. But they do it because they're the only access to care that a lot of people have. And they're really the only way that a lot of the people in the community can get stabilized as emergency care and then make that 30, 45-minute drive to either Zanesville or Marietta or Athens.
Okay. So basically the EMTs become the primary care is what's happened.
Pretty much.
Yeah. Okay. So in that reporting, you tell a story about a man who happened to be a Christmas day, came to the EMS office seeking care apparently, but never quite made it to the where the people were there that day working and gathering, but they were not able to help this guy because he died before he got to them. That's one of your stories, narratives in the story?
Yeah. So that was a story. There were many stories very similar to that, where people would show up at the M&M Fire Department in an emergency situation, but by the time that people could care for them, something terrible had happened because they had to drive from a very long distance, or they didn't feel comfortable going to a hospital, and by the time that they thought, okay, I do need to seek care, that distance was too great. So there was an older man, that Waylon Clark, one of the EMS workers who at the M&M Fire Department, he's been in emergency services around 20 years, on and off, and mostly in McConnellsville. But there was a man who they found unfortunately passed away in the front room of their day room, as they call it, a place where they take rest for the day, because he simply was too sick. They're not really sure what he was sick from, but he couldn't reach the kitchen where a lot of the workers were celebrating Christmas with their family, through no fault of anyone's, except that this man, unfortunately, whatever health issues that he had, were just too severe, and he ended up very sadly passing away. So
the lack of doctors is not just a Morgan County problem. Your story, there's a chart with your story in print that shows, I think it's roughly 20 or so counties that have a very low number of doctors. So what did you find out about in talking to experts about the lack of doctors? What's behind that, and any other information you have on that?
Yeah, so It's messy. It's very messy. But yeah, according to the Ohio State Medical Board, there are roughly 17 counties that have less than 20 doctors. Their public business addresses listed in those counties, which often serve tens of thousands of people, right? Even if they're a little bit more spread out in these rural areas. And as I was talking to industry experts about like, okay, why can't we get there's people out here, right? There's over 10,000 people in all of these counties. Why surely we can get a doctor out here to serve 10,000 people. But unfortunately, what they explained to me is that when you have hospitals built in rural counties, there is this infrastructure that honestly has set up a lot of these rural areas, unfortunately, to fail, called the Medicare Wage Index. And it was set up in the 1980s, back when it was assumed that rural areas had a lower cost of living and a lower wage. And so hospitals didn't necessarily need to be reimbursed at the same rate as like more urban hospitals. And there were factories out there, right? There was coal, there was all of these different industries that have since disappeared, especially from the Appalachian areas in southeastern Ohio, that were there in the 1980s that had labor, but now so much of that has disappeared that you have these more and more people, more and more populations utilizing Medicare and utilizing Medicaid, which reimburses hospitals at a 2.5 times lower rate than private insurers. So though the 1980s infrastructure was set up in this way, that hasn't really gone with the times. It hasn't been updated to a modern cost of living, and it hasn't accounted for all of the labor that has left those areas. And then you have Medicare and Medicaid, which is most of the population that these hospitals are serving, that has a lower reimbursement rate. So rural hospitals are doing the exact same thing that urban hospitals are doing. There's a lower standard of care in rural areas. But they're getting paid a lot less for it because the majority of the people that they serve, they don't get reimbursed at the same rate as like a private insurer, say in Columbus, where a good chunk of the population are workforce that have private insurers.
So just to summarize this a bit, you have rural areas with declining population, as we've reported back in the fall. You have lots of industry in a lot of these rural areas of Ohio. More people on Medicaid or Medicare, it's the aging population. And when they seek out medical care in a hospital, they get that facility gets reimbursed less for whatever procedure is done than a hospital in Columbus would, because the cost of living is viewed to be higher in Columbus, which it is, I guess. So you in your story, you talk to a expert who says that this model for rural healthcare is simply not sustainable. You talk about that a little bit?
So every industry expert that I spoke to, not just the people who are actually in the story, but every industry expert that I spoke to had something along the lines, if I asked them a question like, is rural healthcare sustainable? No, because, we live in a for-profit healthcare system. And so the hospitals need money to operate. And if they're being reimbursed at lower rates, and if there's less of a population, right, to give money at all, whether it's at a lower rate or not, you can't operate a hospital. They're going to have to close. And that's going to leave tens of thousands of people who desperately need health care, and which data has showed, the Health Policy Institute of Ohio has shown that rural Ohioans are often sicker and older and more impoverished than their urban counterparts. We have this very, very vulnerable population that simply isn't going to get care because rural healthcare is not financially sustainable in the model as it's currently set up. Yeah.
So, I mean, you actually, this package is a two-part package. You have a little bit of solutions in Sunday's story and another story on Monday along this lines of what people are doing to solve the problem. So what reasons do we have for hope in this front, and what's kind of going on? What are people trying to do to help solve this crisis, or at least mitigate its impact?
So there's certainly a lot of people who really believe in rural healthcare, which is really great news. It is a very big problem. It is very complex, but there's a lot of really wonderful people that I met during the story who are really trying to help and who are trying to get things like preventative care into rural communities so that people don't have to be driving 45 minutes to realize that they're a lot sicker than they thought that they were. So, for example, Memorial Health System, with the help of the state, is building a massive women and children's hospital in southeastern Ohio. We have several health systems that I spoke to who are engaging in mobile clinics. So they'll go out to different school districts so that when parents drop off their kids can get care right at school and they don't have to drive somewhere else. And sometimes the parents can get kids there. So like Adina Healthcare is trying to create more mobile clinics this past year to make sure that people can get their health and preventative care a lot easier and in one place, right? School is usually a community focused place, but then we also have the Charitable Health Network, which has free clinics in dozens of the 88 counties across Ohio. And that's one that we visited. We visited one down in Chillicothe, a free health clinic. There was a line out the door. It's really, really wonderful, dedicated people who volunteer their time to get free pharmaceutical and clinical care to the people who need it most. So like good, hardworking people who are just down on their luck for one reason or another, or who have been burned by a health system. Spoke to a man who got hit by a truck and going 60 miles an hour while he was on foot and can't work anymore, right? He didn't ask for that. But this free health clinic is really the only way that he can get his medication and his blood work that he needs done every 4 to 6 months. Talking to a woman who was too young to be on Medicare, but could only work part-time and had a heart attack. Had never had any heart issues before, but just had a heart attack and was taken to a hospital and now is hundreds of thousands of dollars in debt. She's working on trying to get help with that, but she goes to the clinic because it's free, because she can't afford to be obviously any more debts. And we met this wonderful woman. I could go on and on, Mike, about the really wonderful, hardworking people that I met in rural healthcare. They are fantastic and they are working very hard. But especially this woman named Karen Fry, who is the director of nursing at this Hope Clinic in Chillicothe, who has been a nurse for 50 years. She's not stopping anytime soon because she understands that people in her community need her. And I know that there are many Karen Frays out in the world. And I think from what I've also heard about industry experts is it's very, very hard. It has to start from the ground up. And we have to believe that rural healthcare, even though it's not raking in the money, like a lot of urban hospitals are, you have to believe in it. Because ultimately it's providing care to the people who need it most.
All right, well, Samantha, thank you so much for your time today and your passion for this subject and your reporting on this project. Once again, folks, that'll be available on dispatch.com beginning this weekend. And this is part of the Dispatch's focus on all the issues confronting all parts of Ohio. We had a piece back in the fall on population loss in the rural areas that Samantha is focused on in this piece. And we have more plans coming up, and we're really interested in your feedback on this issue too. So if you have any thoughts about the challenges confronting rural Ohio on healthcare, population, or whatever the case may be, jobs, et cetera, feel free to email me at mshearer@dispatch.com. That's MSHEARER@dispatch.com. And we'll get that to the right people in our organization. Also welcoming opinion columns and thoughts on these topics at any time too. So that's it for this week's episode of From the Editor. And Samantha, thanks again for your time and your work on this.
Thank you so much for having me. I could talk about this for another hour.
That's very obvious, and that's great. I love the passion. Next week, we'll be back with next week's cover story is a profile of one of the largest companies you've never heard of that's based right here in Columbus, Ohio. And we'll have that for you next week with one of our reporters, Jim Weicker. So stay tuned, and we'll see you next week. Thanks, everybody.